Good morning, everyone. Welcome to Medicare Monday with Indiana SHIP, the State Health Insurance Assistance Program. We're glad you joined us this morning for Ask an Expert. And we have two experts with us, Melanie and Megan, my co-hostesses. And then maybe I'll take an easy question. Today, my background is a little different than usual because I am down in Linton, Indiana, in Greene County, right in the parking lot of Greene County Health, where they have a food distribution event going on today. And sad to say, the cars are already parked all the way out to the street waiting in line for this. So if you are in need of food or you want to volunteer or donate at a food distribution event that SHIP is associated with, check out our events calendar on our website, and that will tell you about where all we will be. So, good morning, Melanie and Megan.
Good morning, Susan.
And Melanie is also in the country, and she's streaming this for us, but she may not be able to participate with her video. So it's raining down here. We've had lightning and thunder. I don't know what it's doing up in Valpo. Wendy's can't join us and give us the weather report up there. What's it doing in Plymouth?
It is cloudy and muggy. It rained a little bit this morning, but nothing for a while.
Okay. All right. Well, today we are going to just take questions from the audience. Megan, what do you have for us? Do you have questions this morning?
I don't see any in the chat yet, but I have had a couple texted to me this morning. Wendy was not able to join us today. She had a conflict. So she texted me a couple questions for us to answer this morning. So the first one is, my husband is a veteran. He can get veterans health insurance. It's free. Why would I pay for Medicare health insurance? Do you want me to take that one, or Susan, do you want to take it?
It doesn't matter. You can go ahead and take it.
I'll give it a shot. So that is a very good question, Wendy, and it's one that we get quite frequently as SHIP counselors. So veterans insurance can only be used at the VA. So if you have a health issue that is not being handled by the VA or won't be covered by the VA, then you're going to need insurance to treat that health condition. Same with the drug coverage. So you can only get your covered drugs that the VA covers through the VA pharmacies. If you have an outside of the VA primary doctor and you have high cholesterol that's being treated by that doctor, then you can't get your high blood pressure medicine covered by the VA. It would have to be covered by other insurance, or you pay out of pocket. So if you have other health issues going on that aren't covered by the VA, then you really want to look at getting your Medicare as well, because the Medicare is going to cover that. Anything you should add to that, Susan?
Well, Megan, when you first said veterans health insurance, I automatically thought of Tricare or Tricare for Life, which is true insurance. It complements Medicare. It does. Tricare for Life does cover some things that traditional Medicare does not. Tricare for Life is for retired from the military. So this would be somebody that was getting a military pension from retirement, and then they're automatically signed up for Tricare for Life. So with Tricare for Life, most folks do have their Part A and B, and then Tricare acts kind of like a supplement and picks up what Medicare A and B doesn't. But going and getting your health care at a VA facility isn't really insurance. It's just a place where you can go if you are on the list of people who can get medical coverage at the VA. And I wouldn't say all veterans can have all services at a VA facility. So you're kind of at the mercy of the Veterans Administration and who they're covering and what they're covering. So a lot of veterans I know do have Medicare A and B, even if they go to the VA clinic for their care, just like you were saying, Megan,
Mhm.
for a little extra coverage in case they need help outside of a VA facility. But I wouldn't call that insurance. I would call that a place where you can go to get care if you're on the list of people who can do that.
Good clarification. I meant to bring up Tricare, but by the time I got done talking, I completely forgot about it. So that's why the three of us do this.
Three
We
heads are
support.
definitely better than one. I
Exactly,
count on you
exactly.
guys.
Especially with Medicare. So that's why there's three experts.
Absolutely. Well, I remember is Tricare for Life pays secondary. So you want to make sure that you do care Part A and Part B.
Mm-mm.
Because Tricare for Life lacks a supplement. And then the things is the VA benefit. I think of that as oil and water. So VA works within the VA and Medicare works within the Medicare, but together. So they don't supplement each other. So I always just think of them as oil. So you can have both, but they don't coordinate. So those were some really good questions. It's all thinking early on Monday morning. So thanks for that too.
All right, so I've got another one.
Okay.
Oh, go ahead, Melanie.
I was just gonna prep you up for your next question so that Wendy sent you a list. And
Yes.
we want to make sure we answer your questions.
Yes. So the next one is my friends all have plan AYZ. So that is what I'm going to get when I'm ready for Medicare. Is that something Wendy can do? Get the same plans that her friends have?
Well, it depends. And of course, that's the answer. That's the initial answer for many questions that we get about Medicare. So sometimes we're going to have to gather a little bit more information to really give you a personal answer. That's why it's really good not to get your information from the internet or from your friends or relatives or a lot of times even printed publications is not a good place to get really personal information. And of course
Mhm.
we all know that the place to get personal information is through the SHIP program. We're the only impartial service that provides that. So we're always able to help you can take into consideration all of your details. But I would generally say making a decision on Medicare benefits based on what all your friends have or do is probably not the best idea. There are so many little things that come into play when you're looking at what kind of choices you want to make. And if you need somebody to bounce those things off of or help get clarification, of course, that's why we exist, to do just that. But I know what it's like to sit around with your friends and talk about this or that. And you don't want to be the odd person out, but sometimes your situation may be different than your friends, and it might call for a different way to go with your Medicare benefits.
Exactly. I had a client I worked with last year and completely the same situation. She came in with her cousin and she wanted the same exact plan he had because he didn't pay anything. Well, he had an Advantage plan. He had Medicaid, which was his secondary. So that paid everything. So we had to explain the fact, that there's, first of all, with our Medicare plans, there's different plans out there, different zip codes. They didn't live in the same county. So there's a possibility that his Advantage plan wouldn't even be offered in her county because it's based on zip codes and areas. And the other piece that I had to explain is your medication. You're not on the same medication as your cousin. And a big factor to what make plans the cheapest for you or the best plans for you are based on your medication. And I had explained that could be a big factor. That is a good plan for him because of his zip code and his medication. It may not be the same for you. And then there's a second layer that he was getting assistance. Now, she qualified for that assistance, but we had to go through the process of applying. And if any of you work with Medicaid, you know that that can take a while. And she needed her Medicare plans before the Medicaid would kick in. So it, just like Susan said, it's great to chat with your friends and your family members and talk about what they have and their experiences. But really, you want to meet with a SHIP counselor to get that personalized one-on-one, because everyone's situation is different. And what I tell spouses when we're working together to get them on drug plans at the same time, I tell them, don't be surprised if we put you on different Part D drug plan companies, because generally spouses are not on the same medication. And that's what the copays is, what's going to make those plans the cheapest for you. So Mrs. might be on one plan and Mr. might be on another. So don't be surprised with that. It's very common. So we have a couple questions in here in the chat box. First off, some shout outs. We've got Libby, one of my new counselors up in Elkhart County. She just got done with training and she's rearing to go to help some people. Fun fact, Libby used to be an intern of mine when I worked for an area agency on aging. So I put a shout out on my Facebook page a couple months ago, and Libby said, sure, sign me up. This sounds fun. Wait till she gets into the mentoring. But then we've got Valerie, who's over in Lake County up here. She's watching too. Good morning, ladies. And then we've got some questions from Sean and Sarah. So the first question from Sean is, when helping clients who have collecting, bargaining, retiree insurance, what is the best approach at providing them Medicare information and plan options?
Well, I will take that one.
Thank you.
That is one of the questions that SHIP counselors ask, because what we are experts in is Medicare. We are not experts in any kind of retiree packages or union retirement packages. There are highly paid people who work for large companies or unions who are experts in their benefits and how they work with Medicare. So if I have a client who is, just say they're going to be new to Medicare and they're going to be retiring, well, one of the first questions I ask is, are you going to have insurance when you retire? And if they say, well, yes, we've got a retirement benefit and I'm going to get my insurance through them, but I need to know what I should do about signing up for Medicare. And, do I get that plan Jimmy Walker talked about? I want to have money back, and so on and so forth. So I always say, I can tell you what you need to know about Medicare and what it covers and how it covers it. But for how it works with your retirement package, you need to talk to your retiree folks at your company or whatever benefits management company handles that. So I remember a couple of years ago, a good friend of mine was turning 65 and we were looking at supplement plans. That's what she had chosen. And another one of our friends was also turning 65 and retiring, and she worked for a very large pharmaceutical company who offers retiree insurance benefits. Well, she was a little perturbed that she couldn't have the choices that our other friend had. And I had to say, well, no one's paying for her plans like your retiree is. So you got to go with what they're going to pay for. So you need to get your information from them. So I couldn't help the one friend who was retiring from the pharmaceutical company, but I did give information to my other friend because she was just like most beneficiaries, and an increasing number these days. Many companies who used to offer retiree packages, which included health insurance benefits, aren't doing that any longer. So, Sean, I hope that answered your question. Don't feel compelled to be an expert in retirement packages that come from companies or unions. We got to stick to Medicare.
Thank you, Sarah. Or you're not Sarah, you're Susan. I'm looking at my phone and I've got Sarah's question coming up next. What can I say, folks? It's been a Monday. So Sarah's question is, if my parents have questions about their Medigap plan, which is a supplement, do they call you, so SHIP, or can they find a site close to where they live? Susan, you want to take that one again?
Sure. Well, I guess that's kind of both. I mean, you call our
Mhm.
toll-free number to find where a SHIP site is close to you. So on our last slide, and certainly all over our website, we have our toll-free number, which goes to our call center, which happens to be downtown Indianapolis. And those folks will ask you where you live. And then they will give you a choice. You might even have a couple of choices depending on where you live of local SHIP sites
Mhm.
that can help you with your questions about your Medigap plan. Now, sometimes that involves a three-way phone call or a group phone call to the actual insurance company that provides that plan. It just kind of depends on the questions that they have.
Thank you,
So
Susan.
call our toll-free number and then we'll hook you up with your local place.
All right, I don't see any other questions in the chat box yet. And I asked all of Wendy's questions.
Well,
Do any of you?
you know what my biggest question is that I
Yeah.
get? The question I get all the time is, do I have to sign up for Medicare?
Mm,
I bet you and Melanie get that question a lot.
yes.
And of course, what's our, you know, more often than not answer? Well, it depends.
Mhm.
So, folks, if you are an actively working employee of a large company who offers credible coverage for health insurance, then you do not need to sign up for Medicare, regardless of what your friends tell you, or the TV tells you, or the emails, or all that mail that's coming to your house. So, if all of those things and all of those things apply to you, you don't need to sign up for Medicare. But when you get a little nervous and say, "Oh my goodness, do I meet all those criteria that Susan said?" Just call us and we will tell you again
Mhm.
and remind you and reassure you that you don't have to. Perhaps you can, but that's where sitting down with a SHIP counselor to look at
Mhm.
Medicare costs and coverage compared to what your employer group plan offers. And then we throw in some little crazy details like, are you signing up or are you participating in an HSA, which has its own little complication. But that's probably the question I get most frequently. How about you gals? What do people ask you?
I
How
would say
about,
that's the top one
okay,
that I get too.
yeah. How about, is there any help for Medicare beneficiaries to pay for all
Oh,
that stuff? Megan or
that's a
Melly,
good.
you want to take that one?
Yes, that is another one that I get. I'll get, I can't afford my Medicare. I've been on some form of Medicaid for years, and now I'm being forced into Medicare and have to pay $170 a month. I can't afford that. Well, let's talk about some programs out there that can help you. There's the Medicare Savings Program that helps pay for your premiums for your A, if you're someone that has to pay for your Part A and your Part B. And depending on there's 3 different programs for the Medicare Savings Program. Depending on what tier you're on, it may also act as a secondary insurance and pay for copays and deductibles. And then we have extra help. We have extra help that also covers your medication. So it may help pay for your Part D medication premiums and your copays. So those are programs out there, and a SHIP counselor can help screen you for those programs. And if you qualify, we can help you apply for them and work through the process of getting on those programs. We do have a slew of questions that have come in. So the first one is from Sarah, Sarah asks, does Medicare cover medical equipment? And it does, depending on what medical equipment you're talking about. But primarily, they're called durable medical equipment, DME, and Medicare will cover most of those as long as your doctor provides an RX script for them, certifying that you need them. And they have to be used primarily in the home. We did a DME Facebook Live just a few weeks ago, which you can find on our Facebook page and our YouTube page to get all of the fun details. But Part B, your medical insurance, is what's going to cover that durable medical equipment. And generally, unless you have a secondary insurance, you're going to pay a 20% copay for those. But the big ones that Medicare will cover are walkers, canes, and wheelchairs. Sometimes they'll do grab bars or bedside commodes, depending on your needs. But the mobility ones are the big ones. Brooke asks, how do I enroll in Medicare? And how do I know?
I was just going to add real quick.
Yeah, I'm sorry.
Can you hear me?
Yeah.
I was just going to add that one of the durable medical supplies that we always Part D, as in drugs, because you go to the pharmacy to refill it, but your diabetic testing supplies and the things that you are, testing your blood sugar and things like that, that is through your Part B as boy or business as well. So I was just going to kind of add, and then before we move too much further, I wanted to answer Libby's question. I thought you at least needed Part A, talking about, I wanted to circle back to that when we talked about the coordination of benefits. And when you do have, let's say you're still working or your spouse is working and you are turning 65 and you want to keep that employer covered large group health plan. If you were not currently on Social Security benefit, you will not be required to take Part A. Now, can you? Absolutely. A secondary to your employer plan through you or your spouse. If you are on Social Security benefits and still working, Medicare will automatically enroll you in Part A. So just wanted to clear that up before we moved on. Thank you.
Thank you, Melanie.
Thanks for the questions, guys. This is great.
Mm-hmm. And thank you for clarifying that durable medical equipment. I completely forgot about that. And that is a big one that we get asked quite a bit with the medical supplies. So thank you, Melanie. So Brooke asked, yep, it does. Like I said, there's 3 of us. How do I enroll in Medicare and how do I know I'm eligible? Who wants to take that one?
I'll take that one, and this will be my last question because I have to get out here and help load food into people's cars.
Okay.
So how you apply for Medicare? Well, you do that with our friends at the Social Security Administration. So there are several ways you can do that. You can go online and apply at ssa.gov. You can call your local Social Security office and enroll over the phone, or you can make an appointment at your local office and do that in person. Now, I will share that they are experts in Social Security benefits, and they are experts in enrolling folks for Medicare. But when it comes to what Part D plan do I get? Do I get an Advantage plan or do I get a GAP plan? All those kinds of questions are way beyond the purview of Social Security, and those are solidly in Medicare. And so SHIP is your local Medicare office, accessed by phone and local counseling sites. So that's how you apply at Social Security, either online, by phone, or in person. What was the other part of the question?
How do I know I'm eligible for Medicare?
Well, folks are eligible for Medicare if they've worked 10 years or 40 quarters, as they say, making a certain amount of money during those 10 years or 40 quarters, and you are age 65. Some people qualify for Medicare because they're on Social Security disability for 24 months. And then on that 24 month, your Medicare benefits are going to kick in. Some people are eligible for Medicare because they have end stage renal disease or ALS. And some people are eligible for Medicare because they're married to someone who has worked 10 years or 40 quarters and contributed to Medicare taxes at a certain rate. So you can get benefits from your legal spouse's work record. And those
Thank
are the
you,
ways
Susan.
that come to mind that you can qualify for Medicare.
Awesome. Now we have one more question from Valerie. What does a person do when they move to another state? Well, that is a very good question. And people need to be aware when they move to another state or even within the same state, but another county. Bye, Susan.
Bye, everybody.
They need to contact their current plan to see if that plan is going to cover them in their new zip code. It could be a zip code in the same county. It could be a different county. It could be a different state. But they all, when they're switching zip codes, they really want to call their drug plan or their advantage plan to make sure that that plan is going to cover them or not. If it doesn't, they have 63 days from the move to get a new plan. So they are welcome to call a SHIP counselor, and we can help them with three-way calls with calling their plan, with switching a plan, and help them navigate what is a great plan for them in that new zip code. And then if they have a supplement, a Medigap plan, they really don't need to do anything because that plan is nationwide. As long as the doctors or the medical providers take Medicare, that plan will be accepted nationwide. Melanie, anything else you can think of that I missed to that question?
No, you did a great job. The special periods would be triggered in certain cases if you did move to a place where you're plan in network. And then it's just always good practice if you are moving and that's your new permanent to let Social Security know and change that with them, and then also let your, and then those things would be kind of told to you. So it's always good to release the Social Security, and then that would initiate those special enrollment periods, like what Megan. So great question, Valerie. Yes. And wonderful job, Megan. So I think that kind of sums up our comments. Megan, did you have any other to you?
No, I didn't. Oh, here is another.
Well, let's talk about,
we got another one
here. Laura Lee.
Mm-hmm.
Yeah, Laura Lee's here. I live in Indiana, but all of my doctors and providers are in Kentucky. Do I choose an Indiana plan or a Kentucky plan? Well, Laura Lee, that would depend on the code. So you would choose a plan based on your permanent address. And so the plans that would be available in your area would be how you would plan. And so you may actually pick a plan that is available in both states. And that's a very common question that I get. I wonder if you gave that one to me on purpose, down south, close to Kentucky. So a lot of the times the plans that are in the zip codes where in Kentucky doctors and live in the service providers are in with those plans that are offered in Indiana. One of the things that you can have done for you during a SHIP counseling appointment is we'll help you check the provider directory in your advantage plan, and we'll help you look at supplements and explain how that would cover that your doctors take Medicare. And if they take Medicare, they'll take your supplement. And in network on that advantage plan, you can give them a quick call and just kind of double check and make sure that plan that you're looking at, all you really need to do to kind of double check and prompt you with those things and kind of look into. So again, great, Laura Lee, and thank you for watching, everybody, and tuning in. Megan, for August calendar, and I'll let you kind of discuss what's coming up. What do you think?
Sounds awesome. So we have a lot of great topics coming up this month. This is our first one for August. I can't believe it's August already. The year is already half over, which is crazy to me. But next week, we will be back with 2 Facebook Lives. On Monday, we've got a special guest, Paul Jones from, and I'm probably going to butcher this, Argability, we'll go with. So he's going to come on and talk about this program. I know they are great advocates of SHIP and provide a lot of our information at events. What to Know Wednesday, we're going to celebrate National Health Center Week, and we are going to have the Indiana Primary Health Association and HealthLink, which is a health center up in northern Indiana. They're in multiple counties. I think they've got 8 sites total, but I think they're spread out in about 5 or 4 counties up here. And HealthLink does a lot for SHIP. They provide our quarterly Spanish Facebook Lives. So we're excited to have both of these agencies on to help talk about what National Health Center Week is. And then on the 15th, we are going to have Lori Powers from the Senior Medicare Patrol, SMP. We've had them on quite a few times, but Lori is new to SMP up in the Northern Territory. So she is their new Education and Outreach Associate. So we're going to meet Lori and talk about what she does for SMP. And then this one I'm very excited about. On the 22nd, we're going to talk about the insurance agents, their do's and don'ts that are set about by CMS, Centers for Medicare and Medicaid Services. So we're going to learn about what they're allowed to do and what they're not allowed to do, and what we can all do if you believe an agent is doing something they shouldn't be doing. And then we're going to wrap up the month by meeting Michelle. She is a new staff member to SHIP. She is our newest public outreach counselor. So we're going to learn more about her role and who Michelle is. So we're very excited for all the topics we have this month. We have 5 Mondays this month, so we're super loaded with topics, and we look forward to seeing you join us for each of those.
Absolutely. Thank you, everybody, for tuning in. Thank you for your questions, and we hope more of our Facebook Lives. And just a quick tidbit, if you ever have a suggestion or a topic that you would like us to cover, go ahead and comment that in and let us know. Call center a call or visit us on our website, or just send us a direct message on Facebook. Thanks again for watching, and we hope everyone has a wonderful week. Happy Monday.
Happy Monday. Bye, everyone.